For years, you have probably heard that snoring is just one of those things annoying for your partner, maybe a little embarrassing in a hotel, but essentially harmless. But what if the science says that snoring, especially when it comes with pauses in your breathing, could be one of the most underrated warnings your body gives you about your heart and your brain? Welcome to Longevity Lab. I'm Claire, a registered nutritionist.
And I'm Robert. Claire, you just made me think about my own bedroom. I always assumed loud snoring meant I was sleeping deeply. Are you telling me that's not true?
It might be the opposite. Not all snoring is dangerous, but when the airway narrows enough to collapse repeatedly during sleep, that's obstructive sleep apnea. And most people who have it don't know they have it. They think they're just tired, or they blame age, or their partner says they snore, and they laugh it off. But the science is now very clear. Untreated sleep apnea is a major driver of cardiovascular risk.
That's a big claim. I thought sleep apnea was a niche problem for very heavy men, maybe with thick necks and a lot of alcohol before bed. You're saying it's broader than that?
Much broader. Yes, obesity is the strongest modifiable risk factor, but sleep apnea also shows up in normal weight people. Age is a big factor because throat muscles lose tone. After menopause, women's rates catch up to men's. Even people with a small jaw, large tonsils, or a crowded airway can have significant apnea. So the stereotype keeps a lot of people from getting checked.
I had no idea. So what exactly happens inside the body when someone has sleep apnea that makes it a heart problem? Because I always thought the main issue was just fatigue.
That's the myth we need to unpack. Let me give you a picture. Picture your upper airway as a soft garden hose. During deep sleep, all your muscles relax, including the ones that hold your throat open. For someone with apnea, that hose collapses, partially or completely, so air can't get through. Your oxygen levels start to drop. Your brain notices and panics just a little hundreds of times a night. It sends out a surge of adrenaline and cortisol to wake you enough to open the airway. You may not even remember waking, but your body does.
So it's like an alarm going off every few minutes all night long.
Exactly. And that alarm puts your heart on high alert. Imagine your heart is a car engine that gets revved to red line every few minutes for 8 hours straight, every single night. That's what sleep apnea does. The oxygen dips, called intermittent hypoxia, trigger oxidative stress and inflammation, which damage the delicate inner lining of your blood vessels, the endothelium. That damage is one of the first steps toward plaque buildup. At the same time, the repeated adrenaline spikes raise your nighttime blood pressure and heart rate, and over years that becomes daytime hypertension. Your body also becomes less responsive to insulin, which pushes toward type 2 diabetes. And the fragmented sleep prevents the normal blood pressure dip that your heart and brain need for recovery.
So the body is essentially stressed all night. But what does that do to insulin and blood sugar? I've heard sleep affects diabetes, but I didn't connect it to breathing.
Great question. Intermittent hypoxia triggers the release of stress hormones like cortisol, which raises blood sugar and makes your cells less sensitive to insulin. Over time, that promotes insulin resistance. The fragmented sleep also disrupts appetite hormones like leptin and ghrelin, which can increase cravings for high-sugar foods. That's part of why sleep apnea and type 2 diabetes often travel together. Studies estimate that up to 1 in 3 people with type 2 diabetes may also have obstructive sleep apnea, many undiagnosed.
Now I understand why you said it's a heart and brain problem, not just a sleep problem. But is the evidence really that strong? Because there are lots of things that are associated with heart disease but don't actually cause it.
That's a fair question, and it's why I want to be precise about what the research does and doesn't show. Large observational studies can't always prove cause, but the consistency is striking. The Sleep Heart Health Study, a landmark multi-center study that followed over 6,000 adults, found that severe sleep apnea was independently associated with a significantly higher risk of coronary heart disease and heart failure, even after researchers adjusted for age, weight, smoking, and blood pressure. And for stroke, the evidence is even more alarming. A pooled analysis found that the risk of stroke increased with the number of apnea events per hour. People with severe apnea had roughly 2 to 3 times the risk of stroke compared with people without apnea.
Wait, even after adjusting for weight? That kills the idea that this is just obesity in disguise.
It does. Obesity is important, but sleep apnea has its own independent effect. The repeated oxygen drops and stress response do damage on their own. A 2021 meta-analysis in the Lancet Respiratory Medicine that looked at more than 300,000 people found that severe obstructive sleep apnea was linked to a nearly threefold increase in cardiovascular mortality. Let me say that again in plain English. People with severe untreated apnea were about 3 times more likely to die from heart-related causes over the follow-up period. That's not a small signal.
That is a much bigger number than I expected. So the next question is the one everyone listening wants to ask. If I snore, does that mean I have sleep apnea? And what should I do?
Great question. And please do not panic if you snore. Not every snorer has sleep apnea. The red flags are more specific. Loud snoring that stops and starts, gasping or choking sounds during sleep, waking up with a dry mouth or a headache, feeling unrefreshed after a full night. And this is important. Daytime sleepiness that makes you want a nap or that gets dangerous when driving. If your partner tells you they have watched you stop breathing for 10 seconds or more, that deserves a conversation with your doctor.
My wife has mentioned those pauses a couple of times over the years. I always thought she was exaggerating. I'm starting to think she was doing me a favor.
She may have been giving you the single most important piece of medical information you have ever received in your sleep. The test is simpler than most people think. You don't necessarily need to spend a night in a hospital sleep lab anymore. Many people qualify for a home sleep study, a small device you wear for one night that measures your breathing oxygen levels and heart rate. The result is expressed as the apnea-hypopnea index, or AHI. That's just the number of times per hour your breathing pauses or becomes shallow enough to lower your oxygen. An AHI of 5 to 15 is mild, 15 to 30 is moderate, and over 30 is severe.
So, if I do have moderate or severe sleep apnea, what actually works? I know there's the mask, CPAP. But half the people I know who got one left it in the closet because it was too uncomfortable.
CPAP, continuous positive airway pressure, is still the gold standard, and the key is understanding what it actually does. It doesn't breathe for you, it's more like a splint for your airway. It delivers a gentle, continuous stream of air that keeps the hose open so it doesn't collapse. When fitted well, it can dramatically reduce apnea events. But you're right that comfort is a major barrier. Many people need a few different mask styles, a pressure ramp setting, or heated humidification to make it comfortable. A good sleep specialist will troubleshoot with you until it works. The research shows that when people consistently use CPAP for at least 4 hours per night, the cardiovascular benefits become clear, especially in blood pressure. One randomized trial in people with resistant high blood pressure found that CPAP significantly lowered 24-hour blood pressure after just 12 weeks. That's meaningful.
So it's not about being lazy if you stop using it. It's that the therapy needs to be fitted properly. That makes me feel better about anyone who tried and gave up.
Exactly. And there are alternatives for mild to moderate apnea. An oral appliance fitted by a dentist can reposition the jaw to keep the airway open. Positional therapy can help people whose apnea happens mostly on their back. Some people sew a pocket into the back of a shirt and put a tennis ball in it so they stay on their side. Weight loss, if relevant, can reduce apnea severity, and even a 5 to 10% reduction in body weight can significantly lower the AHI. But lifestyle change works best alongside medical treatment, not instead of it.
What about the simple stuff, like alcohol and sleep position? I have been known to have a late night glass of whiskey to help me sleep. Could that be making things worse?
It absolutely can, and this is one of the most immediately actionable changes. Alcohol relaxes your throat muscles even further and can increase the number of apnea events, even in people without a formal diagnosis. Having that nightcap close to bedtime, especially within 3 hours, can worsen oxygen drops and make the apnea louder. I'm not saying you can never enjoy a drink, but if you're concerned about sleep apnea, moving it earlier and avoiding alcohol close to bedtime is a simple, no-cost intervention. Sleeping on your side instead of your back also helps many people. And keeping your nasal passages clear, whether that's treating allergies or using a nasal strip, can make a difference if nasal congestion is contributing.
This is all very practical. I was worried you were going to tell me I need a machine and a list of supplements. Instead, you're saying there are real steps I can take tonight.
And here's a specific one backed by research. A 2022 systematic review found that regular moderate exercise, roughly 150 minutes a week, spread across at least 5 days, reduced apnea severity by about 20 to 25% in people with moderate sleep apnea, even without major weight loss. The mechanism likely involves improved muscle tone, reduced inflammation, and better sleep architecture. So you don't need to lose 50 pounds before you see benefit. You can start with brisk walking, cycling, or swimming, and your airway may thank you.
Now, that's a number I can take action on. And of course, if someone already has heart disease or uncontrolled high blood pressure, they shouldn't just try lifestyle stuff and skip the doctor, right?
Right. If you have existing heart disease, resistant hypertension, a history of stroke or arrhythmia, or if you feel so sleepy during the day that it affects your driving or work, please have that conversation with your doctor before making any changes. Sleep apnea can interact with medications and underlying conditions, and a sleep study is often the safest first step. This is health education, not medical advice. The good news is that once sleep apnea is identified, treating it often improves the very conditions that made it dangerous in the first place.
What about the connection to atrial fibrillation? My doctor once mentioned that sleep apnea can cause an irregular heartbeat. Is that true?
Yes, sleep apnea is one of the strongest modifiable risk factors for atrial fibrillation, AFib for short. AFib is when the upper chambers of the heart quiver instead of pumping in rhythm. That leads to blood pooling, which can form clots that travel to the brain and cause a stroke. The nightly oxygen drops and pressure swings in the chest stretch the heart's upper chambers and can trigger arrhythmias. The encouraging part is that treating sleep apnea reduces the burden of AFib in many people. Some studies show that CPAP users are more likely to stay in normal rhythm after a cardioversion or ablation procedure than non-users.
So this isn't just a risk factor for future events. It's something that can actually trigger immediate heart rhythm problems. That's eye-opening.
Exactly. One 2023 real-world analysis followed Medicare-age adults with newly diagnosed sleep apnea. Those who started CPAP and actually used it consistently had fewer hospitalizations for heart failure and stroke compared with those who didn't use it. But, and this is crucial, the benefit disappeared in people who used CPAP less than 4 hours a night. So the magic isn't in buying the machine, it's in using the machine. That's the exact same conclusion as a randomized study in the Lancet Respiratory Medicine that I mentioned earlier.
That's so important because I think a lot of people imagine that once the doctor prescribes CPAP, the problem is solved. But you're saying the therapy only works if you actually use it. And that's where the health system often lets people down.
That's right, and that's why I always tell people to go back to their provider if the mask hurts, if they feel claustrophobic, or if the air pressure feels too high. There are almost always solutions. Desensitization can help. Some people start by wearing the mask while watching TV for short periods. Heated humidity can reduce dry mouth. A different mask type, like nasal pillows instead of a full face mask, can make a big difference. If you have claustrophobia, a dental device might be a better fit. The worst outcome is silent non-adherence. The machine sits in the closet while the apnea continues untreated.
What if someone lives alone and doesn't have a partner to notice the pauses? Are there signs they can spot on their own?
Absolutely. Watch for morning headaches, a very dry mouth when you wake, frequent nighttime urination, and feeling exhausted despite 7 or 8 hours in bed. If you use a smartwatch or sleep tracker, repeated oxygen desaturations or frequent awakenings can be a clue, though those gadgets vary in accuracy. The most useful self-check is the Stop Bang questionnaire, which asks about snoring, tiredness, observed pauses, blood pressure, body mass index, age, neck size, and gender. If you score high, that's a good reason to request a sleep study. You don't need a partner to notice, you just need to connect the dots.
So let me make sure I understand the big picture. Sleep apnea is not just about snoring or feeling tired. It's a repeated nightly stress test on your heart and brain. The oxygen drops, inflammation, and adrenaline spikes can raise blood pressure, damage blood vessels, and push toward diabetes and stroke. The good news is it's detectable with a simple home study, and treatments like CPAP, positional therapy, weight loss, exercise, and avoiding alcohol before bed can actually reduce a lot of that risk.
That's exactly right. And today's rule, write this down. Snoring that pauses is a vital sign, not a personality quirk. If your body is sending that signal at night, don't wait until your heart has to shout.
And here's my personal takeaway. I'm going to ask my wife tonight if she has ever heard me gasping or stopping breathing. If she says yes, I'm calling my doctor tomorrow and asking about a home sleep study. And that late night whiskey, I'm moving it to earlier in the evening, at least for now. That's one change I can make without waiting for a diagnosis.
That's an excellent place to start. And if today's episode made you rethink your own sleep, follow Longevity Lab wherever you listen. We release a new science-backed episode every day, always translating the research into things you can actually use. No hype, no fear. Subscribe and hit the bell so you don't miss tomorrow's myth-busting topic.
Until next time, sleep well, and if you don't, now you know what to do about it.